Hello everyone, we're from SGD B3 and we will present our student project Ventricular Septal Rupture as a complication in acute myocardial infarction. This is the chapter 1 introduction. My name is Aryana Ningrum with 3-digit student number 159. Ventricular septal rupture or VSR is a complication that can occur due to acute myocardial infarction. It is a condition that causes obstruction of blood flow to the heart and result in coronary circulation not improving and necrotic tissue occurring, which is related to the VSR condition. Even though this complication is relatively rare, VSR is a serious complication with high death rate. In most cases, the symptoms may include increasing chest pain with the loudest murmur at the apex. Various methods have been used to reduce mortality and morbidity rates due to VSR, one of which is stabilizing hemodynamic status. VSR management needs to be carried out immediately to prevent further hemodynamic damage that can occur. For this reason, sufficient knowledge about VSR is needed so that a correct diagnosis can be made immediately. And this is the problem formulation. What is the definition of myocardial infarction and ventricular septal rupture? What is the epidemiology, etiology, pathophysiology, diagnosis, differential diagnosis, treatment, and prognosis of ventricular septal rupture? The objective of this student project is written in the slide, and the next is benefit of this student project.
Allow me to introduce myself. My name is Carla Manullang with my last 3 digits are 146, and now I'm going to present about the definition of myocardial infarction and ventricular septal rupture. So, ventricular septal rupture or VSR is a condition due to perforation of the interventricular septum, thus forming a shunt between the two ventricles. VSR involves coagulation necrosis that occurs due to the denaturation of proteins caused by a reduction in oxygen supply to the myocardial tissue. Ventricular septal rupture or VSR is a surgical emergency complicating acute myocardial infarction or AMI, calling for a closure of the septal defect along with coronary artery bypass, grafting in symptomatic patients. The main etiology of this condition is myocardial infarction, extending to transmural or full-thickness infarction. Both anterior and inferior infarct has a relatively similar frequency to cause VSR. That's all from me. The next part will be continued by my colleague. Thank you.
Hello doctors and friends. My name is Natalia with the 3 last digits to the number 109. Now I'm going to present about the epidemiology of ventricular septal rupture. Ventricular septal rupture, abbreviated as VSR, is considered as an atypical complication with an estimation of 1 until 3% occurrences in the case of acute myocardial infarctions, with the mortality rate of 5% following a heart attack. However, the occurrence of VSR has decreased significantly to the rate of 0.31% in recent years with the coming of viable treatment such as reperfusion therapy.
My name is Nandhita Naaz with the last digit of my student number 189. And now I will explain about the etiology of ventricular septal rupture or VSR. One of the most common etiology of VSR is myocardial infarction, usually known as a heart attack. The wall that separates the heart's ventricles or the septum may be affected by myocardial infarction, which could weaken the tissue and raise the possibility of a rupture or tear. A transmural infarct in any of the following coronary arteries is the most frequent cause of VSR. First is left anterior descending artery. It mostly supplies the anterior part of the interventricular septum, and this might result in apical VSR. Second is dominant right coronary artery. It mostly supplies the inferior part of the interventricular septum, and it might result in basal VSR. And the third one is dominant left circumflex artery that arises from the circumflex branch and supplies the posterior part of the posterior descending artery.
Thank you for the opportunity. My name is Gede Saputra with last 3-digit number of NIM 018, and I would like to discuss with you guys about the risk factor of ventricular septal rupture. There are several factors in contributing to the increased risk of ventricular septal rupture, such as the first one is neo-infarction, where the severity of the initial infarction underlying factors predisposing them to complications increasing the risk of VSR. The second one is advanced age, where older than 65 years old, in which age-related changes in the heart structure and function, as well as associated comorbidity, may contribute to the increased risk. The third one is hypertension, where high blood pressure can strain the heart, leading to left ventricular hypertrophy and weakening of the heart's pumping ability, increasing the risk of VSR. Fourth one is female sex, where women have differences in the underlying pathophysiology of coronary artery disease of hormonal influence on the heart's response to injury. And the fifth one is chronic renal disease, where kidney dysfunction can exacerbate existing cardiovascular risk factors and contributing to the development of VSR after a myocardial infarction.
Hello everyone, my name is Dewa Gede Agung Guptha with the last 3 digits of name 072. So at this present moment, I'll be explaining you about the result that came from the pathophysiology of the ventricular septal rupture. Let's recap about defining the VSR. That is the leak in the wall between the heart chambers or the ventricles. There are two main types that can result from this pathophysiology. The first one is that the simple VSR, and the second one is that the complex VSR. The simple one can be defined as the straightforward connection between the ventricles, and the complex VSR can be defined as the winding path with potential bleeding and tears. Obviously, these two types can cause unpredictable heart function into the most declined conditions. And then there are also classification based on timing and severity from the VSR. There are three types of it. The first one is that the type 1, or we can define it as sudden rupture due to heart attack. The second type, we can call it as a delayed rupture, and then the third type, we can call it a weak septum with the bulging, or we can say it as the aneurysm. That's all from me. Thank you for the time.
Okay, thank you for the opportunity. My name is Wilbert Purnamasidi with last digit of my student number is 135. And now I will explain about pathophysiology of VSR. 2.4 pathophysiology of VSR or ventricular septal ruptures. So VSR, this disease basically is a severe complication of myocardial infarction. One of the severe complication of this disease, STEMI or MSTEMI, myocardial infarction. So primarily, this disease is affecting the anterior septal wall due to extensive infarction when myocardial infarction happens. So, how myocardial infarction can cause VSR? Myocardial infarctions basically can cause coagulation necrosis. And this coagulation necrosis can cause the septum of the heart, especially ventricular septum, is weak, weakening of the septum, weakening of the ventricular septum. So, we have also another stressors, especially physical shear stressors. And these two combination, weakening of septum and physical shear stressors, can cause ventricular septal ruptures. Maybe that's all from me about pathophysiology. I give it to my friend. Thank you.
My name is Aisyah Taqiyyaa with 3 last digit number is 076. 2.5 Diagnosis of ventricular septal rupture. Two-dimensional echocardiography with Doppler is used to diagnose ventricular septal rupture, which shows blood flow over the right or left ventricular septum. The color Doppler echocardiography is also useful in the evaluation of anatomical size of rupture.
Hello, my name is Carla, and my last digit number is 016, and I will explain the other technique that is useful in identifying ventricular septal rupture. So TEE, or transoesophageal echocardiography, is a diagnostic technique that is furthermore useful in identifying ventricular septal rupture as a consequence of acute myocardial infarction. So TEE enables the best possible image of the mitral valve in addition to a more accurate representation of the rupture size and form. Utilizing 3D, TEE enhances ventricular septal rupture assessment as well by increasing comprehensions of the hemodynamic and anatomical effects of the rupture. So TEE is also helpful during the perioperative phase because it can offer more details on the rupture size and shape as well as the outcomes of surgical repair. That's all from me. Thank you.
My name is Adrianus with my last 3 digits of my student ID number 104, and I'm going to explain about the DD of ventricular septal rupture. So patients with ventricular septal rupture develops a systolic murmur, which are found in mitral regurgitation, tricuspid regurgitation, and atrial septal defect. Color Doppler ECG can be used to differentiate each of these conditions with ventricular septal rupture. For mitral regurgitation, blood flows from left ventricle to left atrium, and it shows red color. For tricuspid regurgitation, blood flows from right ventricle to right atrium, and in atrial septal defect, blood flows from left to right atrium. In VSR, blood flows from right ventricle to left ventricle. Also, compared to atrial septal defect, pulmonary hypertension and cyanosis is more common in VSR.
Hello, my name is Kevin Andrian Candra with my SGD number 95. Today I will explain the treatment of ventricular septal rupture. The main treatment is surgical repair to close the hole in the septum, with the alternative percutaneous closure or balloon catheter for some patients, but it is only a temporary solution. The goal is to improve circulation in diseased arteries to reduce hypoxia burden. The surgery timing must be performed immediately after patient stabilization, with some exception. The surgical technique used for the surgical is the Gede procedure and David procedure. The Gede procedure patch defect with stitch in both ventricle, and David procedure patch defect with stitch in left ventricle only. With the post-surgical cares is using the anticoagulation medication likely recommended. That's all from me. Thank you.
Hello, my name is Margaretha Jesslyn with my last sheet number is 248, and now I will explain to you the prognosis of ventricular septal rupture. So the prognosis of this disease is determined by these factors. So first one is parameter like age and the presence of shock, and then the time of surgical intervention. So prompt surgical intervention valued in raising survival rate, but there's a study that state otherwise. And then the second one is patient is hemodynamically stable at the time of surgical repair, and then rupture position and extent, and also additional factors that predict death within 30 days are these above. Thank you.
My name is Gede and Renathan with regional student number 1 and 3. Ventricular septal rupture is a serious complication that can arise following myocardial infarction, characterized by a tear in the interventricular septum. This condition occurs due to coagulation necrosis induced by reduced oxygen supply, leading to the weakening of septal tissue, particularly at the junction of infarcted and healthy myocardium. While relatively rare, with an incidence of about 1 to 3 of acute MI cases, PSR is significantly contribute to post-heart attack mortality, accounting for approximately 5% of associated deaths. Diagnosis typically relies on echocardiography, with surgical repair being the mainstay of treatment. Advancement in reperfusion of therapy have led to a decline in VSR incidence, underscoring the importance of early recognition and intervention in optimizing patient outcome. For patients with myocardial infarction, timely medical attention and strict adherence to treatment plans are crucial to prevent complications like ventricular septal rupture. Maintaining a healthy lifestyle through exercise, a balanced diet, and avoiding tobacco and excessive alcohol intake can significantly lower the risk of heart-related issues and improve long-term outcome. Thus, we convey our presentation. Thank you for your attention.